Kawasaki disease is a vasculitis, inflammation of blood vessels, of childhood. It is typically self-limited, lasting for an average of 12 days without therapy. However, the disease may lead to heart complications such as coronary artery aneurysms, heart failure, myocardial infarction, and arrhythmias. The incidence of is greatest in children who live in East Asia or are of Asian ancestry. Boys are affected as much as 50% more commonly than girls. 80 to 90% of cases occur in children younger than 5 years. The etiology remains unknown, but several etiologic factors have been suggested. Immunologic response, infectious etiology, or genetic factors. Major debate concerns whether Kawasaki disease is caused by a single, unidentified agent or an immunologic response to a variety of triggers. There is a seasonal increase in the winter and summer. The clinical features reflect widespread inflammation of medium-sized arteries. Diagnosis is based upon evidence of prolonged, unexplained fever greater than or equal to 5 days in association with bilateral conjunctivitis, erythema of the lips and oral mucosa, strawberry tongue, rash, edema of the hands and feet, and cervical lymphadenopathy typically develop after a brief nonspecific prodrome of respiratory or gastrointestinal symptoms. Cardiovascular findings are not part of the diagnostic criteria, but they support the diagnosis. Treatment consists of a single dose of intravenous immune globulin and aspirin. Treatment within the first 10 days of illness reduces the risk of heart complications fivefold. The major complications are coronary artery abnormalities, which can include dilation, aneurysm, and/or stenosis, reduced heart function, valvular abnormalities, and pericardial effusions. Late cardiovascular complications include myocardial infarction and arrhythmias. These late complications are generally limited to patients who had coronary abnormalities in the acute phase. Follow-up is up to 8 weeks to evaluate for coronary arteries involvement. Further follow-up may be needed according to coronary arteries abnormalities. Patients without any cardiovascular abnormalities appear to be clinically healthy at long-term follow-up. However, it is unknown whether they are at increased risk for atherosclerotic heart disease. Want to know more? Watch my channel.